sensitive teeth hack. Today I'm gonna teach you how to get rid of teeth sensitivity ASAP. Um, as you can kind of see, there's a lot of toothpaste here, right? So the trick to this is you actually have to use a sensitive toothpaste. But you're probably wondering or already thinking, you already use sensitive toothpaste. But I'm here to tell you that you are doing it wrong. Okay, so I will tell you how to do it and also give you an alternative in case you don't have the thing that I'm asking you to use. Of course, the first thing you need is a sensitive toothpaste, which there's like a million different kinds of them, right? The most popular ones would be the Sensodyne toothpaste, but this method works the best if you have some sort of Invisalign retainer, actually, right? So here we have a Vivera retainer from Invisalign. So if you happen to have one of these, that would be ideal and it would work the best this way. So what the hack does, or what the hack is you would basically put sensitive toothpaste into the Invisalign trays or the retainers, right? Or alternatively, you could also brush it onto your teeth, and then you want to wear the trays for at least like 15 to 30 minutes. Yes, you are wearing the trays with the sensitive toothpaste for at least 15 to 30 minutes, and then that will actually relieve your sensitivity. The reason why that works is because all of these sensitivity ingredients, right? So these work via a topical application, which means you're literally applying it onto the teeth, right? You apply it onto the teeth and then it works as it's on the teeth because it is a topical product, okay? And that is different from like a systemic product, such as like you're taking Advil or Tylenol, which gets absorbed through the bloodstream, right? It's like toothpaste are not a systemic product, they are a topical product, okay? And what that basically means for you is that they work based on contact time. So like the longer the toothpaste stays against the teeth, like the more time it has to work. So like a good analogy for that would be if you had one of like the pain patches, and right, if you're having pain like the hot and cold patches or these lidocaine patches, right, you put it on and you know how long you leave these things on, right? If you look at the directions right here, it says use one patch for up to 12 hours. These things are staying on your skin for 12 hours for it to have the maximum effect. Here I have some prescription stuff that's like really powerful too. But as you can see, even for the prescription stuff, where is it? Change topical system every 12 hours. All right, so essentially these topical products, they work based on contact time. But why is it that when you're trying to desensitize your teeth with toothpaste, you're only brushing for 2 minutes, right? 2 minutes, anti hypersensitivity right there, active ingredient. I mean, like the 2 minutes is not long enough for you to desensitize your teeth. I mean, it can work if you're having very mild sensitivity, but if you have anything more than that, like moderate to severe sensitivity, like the 2 minutes is not enough time. So my recommendation is to either brush the toothpaste onto your teeth and then wear these trays, or you could put the toothpaste into the trays and then just wear it for 15 to 30 minutes, and then that would give enough time for the desensitizer to work on your teeth. Okay. I know not everyone is gonna have like Invisalign trays or some sort of clear aligner tray, right? So I mean, alternatively, what you can do is after you finish brushing your teeth, you could just take extra toothpaste and just rub it into the sensitive spots and just let the toothpaste sit and marinate for like 10-15 minutes, or you can even leave it up to like 30 minutes. Just make sure you don't rinse while you're doing it, right? If toothpaste is kind of pooling inside your mouth, just spit it out, but don't rinse, otherwise you will wash the toothpaste away. So what you want to do is you want to try to leave it on the teeth for as long as possible, so it gives the desensitizer as much time to work as possible. So I mean, there's like 1,000,001 sensitive toothpaste here. I also want to go over some common issues with using sensitive toothpaste, which you may be doing that is decreasing the effectiveness of the desensitizer inside the toothpaste. Okay, The number one thing is that most people do not brush for the recommended 2 minutes. Studies show that most people, the average person, will brush for 45 seconds only. That is not enough time. So for all the toothpaste companies, for like the sensitivity, they recommend brushing for at least 2 minutes for you to at least get some sort of desensitizing effect. So if you're not brushing for at least 2 minutes, you're really not taking full advantage of the desensitizing effect. And then number two is that most people, when they're brushing their teeth, right, they're not actually brushing the toothpaste into the right spot. Most of the sensitive spots in the mouth are, like by the gum line where, most people typically have gum recession. Those are the most sensitive spots. So if you're brushing just the enamel on the top, you're not brushing the toothpaste at the gum line, you're missing the spot. You're missing the sensitive spot. So like that toothpaste isn't really doing much for your sensitivity because you're not applying the desensitizer to the sensitive spots in on your teeth, and that's just not going to work. And then the third and last point I want to bring up is that you may be using the wrong desensitizer. I mean, all these toothpastes, they will say like sensitive on here, right? Like sensitive, and then here is sensitive, right? You can see sensitive everywhere. But there are two different types of teeth desensitizers. The first one would be potassium nitrate, which I believe the Sensodyne has. No, not that one. This one, yeah. So this is the first desensitizer, is potassium nitrate. So what this one does is it's similar to kind of how Novocaine works. It just sort of numbs the tooth nerve. So you're still kind of feeling the cold and everything touching the tooth, but you're just the nerve is just not gonna fire any signals because it's just gonna ignore it, right? It's just kind of how like when you're numb, your dentist is drilling on you, but you just like don't really care because it doesn't, you're not feeling any pain, right? So this is the first desensitizer. The second one, which Sensodyne also has, is right here, is actually stannous fluoride, right? You may be surprised, but this type of fluoride, it is a desensitizing agent because you look right there, anti-hypersensitivity, stannous fluoride. Okay, so that is different from the traditional fluoride, which we see here with the Colgate, with the sodium fluoride, right? And the purpose is just anti-cavity. There is no anti-sensitivity with the sodium fluoride. But with the stannous fluoride, you do have anti-hypersensitivity. I think there's another one here too. All right, here we have a Colgate one. Here you see the zoom focus stannous fluoride, and it has anti-sensitivity right there, right? So the stannous fluoride works a little bit differently. It doesn't numb the nerve like the potassium nitrate does. The stannous fluoride actually just clogs up like the dentinal tubules in the teeth, and it prevents the cold and stuff from interacting with the tooth nerve because your teeth actually have pores in them. So, but a lot of times when you drink like acidic stuff, spicy stuff, sour stuff, like the pores will get unclogged, and then all the cold and stuff will just go straight into the nerve, and that's when you feel sensitive. So what the stannous fluoride does is it reclogs the pores so nothing can get in. So basically, what I'm trying to tell you is that if you're using one desensitizer and that one's not working for you, you should switch to the other one to see if it works. And although you do have to use it for at least 2 weeks just to see if it's working for you. Like one day may not be enough time. Okay, so that's the main thing. Although there is a third desensitizing ingredient, which would be the it's a newer one. It's called hydroxyapatite, such as the one you see here on David's toothpaste with hydroxyapatite. It is a desensitizer. It works in the same way as the stannous fluoride does. It clogs up the pores, so that's how it prevents you from feeling sensitivity. And I guess the last thing I just want to talk about is I actually want to talk about currently my favorite desensitizing toothpaste, which would be the Ollie actually. As I said, if one desensitizer doesn't work for you, you can give the other one a try. Instead of experimenting, trying to find out which one works for you, you might as well use both ingredients in one toothpaste, right? So here we have the Ollie toothpaste. You see the potassium nitrate there for sensitivity, but it also has the hydroxyapatite in here too, right there you see it, hydroxyapatite. So this one has the best of both worlds. It has the potassium nitrate and hydroxyapatite. So it will block sensitivity via numbing the tooth nerve, and then it also block the pores too, right? So that is very interesting and unique, because if you use the Sensodyne toothpaste, what I've noticed with Sensodyne is that they will only use one desensitizer, right? They never combine it for whatever reason, right? Here you see this product here, it has stannous fluoride, but it does not have potassium nitrate. And in here we have the potassium nitrate, but it does not have the stannous fluoride. All right. I do have a theory as to why they don't combine these, but I'm not gonna tell you. But yeah, so if you want to take the guesswork out of it, I do recommend using this toothpaste. This one is an American brand. It's not as well known. I haven't found any other product that has two desensitizers in it aside from this one. There is a Japanese brand that does it. It's called Apodent Sensitive, which has the same exact ingredient actually. It has the potassium nitrate and it has the hydroxyapatite. Although that one is kind of difficult to get here in the US. You can find it on Amazon, but it's like $35 for a tube that's half the size of this, which is really pricey. The Ollie is a pretty good deal in my opinion. This one I think, 4-ounce tube, pretty standard. It's about like $12. I'll leave the link below in the video so you can test it out. I mean, if you don't believe me, you can scour the internet trying to find toothpaste with two desensitizers, but you're probably not gonna find it. I guess alternatively, you could just brush with two different Sensodyne toothpaste, right? You could brush with this one after you finish, then you could brush with this one. But then the pricing for that is, each of these are like $9 a tube, and that's $18. But you can do whatever you want. But yeah, so just to recap, the hack is actually just to leave the toothpaste on the teeth for an extended period of time. You can leave it up to 30 minutes if you want, right? Yeah, and that's it for the hack.